It's 2 minutes past 10 on WFM 91.7, and it's time for Radio Doctor. Radio Doctor is Nigeria's first specialized radio health program where real doctors advise real people, and it broadcasts 10 a.m. to 11 a.m. Mondays through Saturdays. Each day is dedicated to a medical specialty with an expert to offer consultation and advice. And this morning, I have in the studio with me Dr. Abiola Ajayi. He is the MD CEO, Arroyo Specialist Hospital. Good morning, doctor.
Good morning. Thanks for having me.
Yes, it's good to have you. And yes, I am Bukola Balogun before I forget about that. And we'll be talking about something that, yes, interesting, dieting, fasting, and eating what's the best way to lose weight. I think so many people, everyone is always particular about keeping in shape. I don't want to lose my shape. I want to ensure that I look good. Yes, in particular.
Are you sure everybody wants to look good, right?
Everybody wants to look good.
I'd say I like to look good.
Everyone really wants to look good.
We all, if whether we admit it or not, we all have that in us where we want to keep our shape and look good. And the thing about it is that as we get older, it becomes more difficult. So the things I could get away with when I was 20 years old, I can't get away with now. I'm 20. I'm 25. I can't get away with them now. So as you get older, things can become more difficult.
All right. Yes, you heard it from the doctor himself. Things can become more difficult. Your bones are stiffer. You can really probably do some of those things you used to do as a young person. Yes. And starting off, what exactly is dieting?
Yeah, the dieting is basically, managing your consumption or controlling your consumption of food and drink.
Okay.
Food and liquid intake, with the purpose of losing weight or increasing weight. So a lot of people think the dieting is just about losing weight,
just to lose weight,
and no, it's about is with the intention of trying to change your weight, whether it's increasing or decreasing your weight. And funny enough, when I was back when I was 20 years old, I would diet to try and gain weight because I was rather thin. Let me put it that way. I won't say skinny, but I was slender. So I would, try and eat in ways that would help me gain weight.
Okay.
But nowadays that I'm a little bit older, I try and eat in ways that will help me maintain my body shape.
All right. It's good to hear that. 07000 917 917 090 256 25455, the studio line to call to be a part of Radio Doctor. And yes, call in to ask whatever questions you might have as regards to your health, and the doctor will definitely answer your questions. And yes, we hear of fasting. Now, there even I don't know, maybe there are different types of fasting anyways, but in quotes, we have different kinds of fasting. You hear of the dry fast. We have the one that I get to break probably later in the day, or you hear, I can just take liquid, I don't eat food. Different types of fasting, and
some what I call brutal types of fasting that I've seen some more fanatic people do. It's to be honest, it's when I came to Nigeria, I actually heard about fasting. In the U.S., we really don't practice fasting, except Catholics around the time of Lent. They'll stop eating red meat, and they consider that a type of fasting. But fasting regularly is not normal to us on that side. But I saw it was very normal here, so I really had to understand it, and it's taken quite some time for me to gain a fairly good understanding about how it works and how it actually helps or hurts your body.
All right, thank you. So what I just want to know, is it healthy? Occasional fasting, constant fasting, is it good for the body?
In preparation for, funny enough, I changed my my own diet in my household about 4 or 5 months ago.
Okay.
And so in preparation for that, I did a lot of research and got a lot of anecdotal evidence as well as research studies. And for healthy individuals, there's a type of fasting that's actually shown to be healthy.
Okay.
And that's what we call intermittent fasting, or some call it controlled feeding, or timed feeding. But intermittent fasting is the acceptable term.
Okay.
And it kind of mimics, when we were in the wild, so to speak. We didn't wake up in the morning. When you were living in caves, and it wasn't that long ago, my grandmother used to tell me about living when she used to live up in the hills in Edo State.
Okay.
Where you don't wake up and get breakfast at 8 and then have lunch at 12 and then dinner at 4. Most of the time, by the time you wake up, you don't really have a typical breakfast. You spend that time gathering food or wood or whatever you need for the day, and then you eat like a midday meal and then an early meal, early evening meal, and then you're in bed just after the sun goes down. So intermittent fasting kind of mimics that, and the studies show that there are a lot of benefits to that. And I will stress, for healthy individuals, at the beginning, there are a lot of benefits.
Okay.
To that, and it's centered around, there are about 3 major types, but one of the most common type, or the most widely practiced, is 16 hours off, 8 hours on. So 8 hours of feeding. You kind of skip breakfast. You start maybe let's say around 1 p.m., 1 p.m., and you'd eat until 9. Now it's different for everybody depending on your lifestyle, because you also don't want to eat and go immediately straight to bed. So for somebody that, let's say, goes to bed at 12, a good period for them would be from 1 p.m. to 9 p.m. that they're eating. But for the rest of the 16 hours of the day, they're fasting. And when we talk about fasting, anything besides water counts as intake. Anything outside of plain water. So some people, because what we're trying to do is we're trying to trick or force your body to burn fats. Instead of burning, instead of trying to save, calories and fats, we're trying to burn fats. And if you see some people that are heavy set and start some of these crash diets or strange diets, they'll just either stop eating altogether and try and starve themselves. And when you instantly put your body into a starvation mode, your body will actually slow your metabolism down and try not to lose weight. Your body will try to protect the weight that it has, because it knows it's not going to see food. It doesn't know when it's going to see food again. So with this timed feeding or timed eating and intermittent fasting, the body will want to burn off the fats and burn off the calories, because it knows it's expecting food to come pretty regularly. And for those 16 hours that you're not eating, it's burning fats. And it's also shown that you will also keep more of your muscle mass, because when you actually put your body into starvation mode with the older types of the diet, and you'll actually start burning your muscle, your protein. And so you see people with less muscle mass, and but the fat still remains the same, because the body is trying to keep that fat, because fat has the highest amount of calories. So this other intermittent fasting, the body starts burning off fat instead of trying to keep it. So completely opposite. And you can see that it really has some benefits.
All right, 10 minutes past 10, WFM 91.7, and yes, it's Radio Doctor, Nigeria's first specialized radio health program where real doctors advise real people. And of course, we'll have a real doctor in the studio. We'll have Dr. Abiola Ajayi. He is the MD CEO, ROA Specialist Hospital. And if you want to get to reach him personally, just call 0705 919 2017. 0705 919 2017. But to reach him in the studio, call 07000 917 917 or 90 256 25455. Send a WhatsApp or a text message to 070 317 56537. And here's we have a text message here, and it says, good morning, doctor. What food and supplement can I take to gain weight?
Yeah, so the science behind gaining weight is not difficult. You want to eat more calories than you burn, right? So most men burn somewhere between 1,800 and 1,800 and 2,200 calories a day. On average, 2,000 calories a day. Women on average about 1,600 or 1,600 calories in a day. You know, a slice of bread here, the type of bread that they serve here in Nigeria, which is cake. To me, I call it cake. It's not really bread. It's sliced pieces of cake, but that's easily 200 calories. Okay, so when you
slice,
yeah, some of them easily 200 calories. So it just depends on the type of bread. So imagine if you sat down and had 4 to 6 slices, you've gone over half of your calories for the day are in the bread alone before you now start adding your other things. So to gain weight, you eat more than you burn, but it depends on the type of weight you want to gain. So it's a complex question. How old is he?
Okay.
What type of exercise is he doing? What's the purpose of gaining the weight? You know, if you're trying to gain muscle mass, yeah, muscles are made of protein, so it's always good to eat high protein diets. You know, but eating a high protein diet can be hard on your kidneys, so you balance that out with drinking lots of water, and you also want to have a diet high in fiber, so you reduce some of the side effects of eating high protein. So, but the main thing is the main thing for gaining weight, besides just eating a lot of volume, a lot of calories, is also your exercise.
Okay.
And when you're really trying to gain weight, remember I was talking about that period where I was intensely trying to gain weight. I would actually lift weights, but I reduce my aerobic exercise. So if you do a lot of aerobic exercise, you burn a lot of calories. So remember how we started off. You want to eat more calories than you burn. So if you're one of these people that plays football for 2 hours a day, and you're trying to get by on the same 2,000 calories that we mentioned, it just won't work. You won't gain weight. Okay. Because somebody that plays, football, whether it's for fun or organized, they're going to burn 4,000 to 6,000 calories in a day, 2 to 3 times what a normal person would burn. So you would need to eat 2 to 3 times as much.
Okay, all right. And I hope your question has been answered as well. So you have been talking about, how to gain weight, how to lose weight. So which is the best way? Just like you have said, there are so many ways. Some people think fasting actually is one of it, but you have been able to break down for us. So which is the best way to lose weight?
The best way is something that is sustainable. Meaning, because you're not going to lose the weight overnight. That's what a lot of people don't know. So the kind of diet or dietary change that you're going to be able to keep on for months. If let's say I wanted to add 10 pounds, I would dedicate the next 6 months to adding 10 pounds of muscle mass. Okay. So not 3 weeks, not 6 weeks, but 6 months. So I would make sure that my diet change is something that I can do for that amount of time. Right. So when we're looking at this intermittent fasting, there's a way of doing it where you can do 5 days on in a week and 2 days off, or 2 cheat days, and we can talk more about that when
all right, 2 cheat days
after the call.
07000 917 917 090 256 25455. Send a WhatsApp or a text message to 070 317 56537. Hello, good morning.
Hello, good morning.
Yes, good morning. What's your name or where are you calling from?
This is Emmanuel. I want to ask just a question.
Okay, Emmanuel, you're calling us from where?
From Abuleba.
All right, Emmanuel, go ahead with your questions.
Doctor, good morning, sir.
Good morning.
Sir, I want to know, I don't know why I'm losing weight. My normal weight was 65. So this year I lose 3 kg. So I went and checked it again yesterday. It is 62. So that 3 kg. I don't know why I'm losing weight.
3 kg in how long? 65. How many months? 1 month, 2 months, 6 months?
That's from May.
From May of this year. Okay.
Yes.
How old are you?
52.
Okay, and is there any change in your appetite? Any change in your appetite? Do you feel you still eat the same amount that you were doing before?
The food I eat before.
Any change in your appetite? Do you still feel hungry? Are you still eating the same way you were eating before, or you don't feel hungry anymore?
I feel hungry. I eat.
Okay.
I eat.
All right.
I have the appetite to eat.
Is it the same quantity you used to eat that you still eat? Is it the same quantity that you eat before that you still eat till now, or it has reduced?
I say eat the same thing. The food is available. I have the strength to eat.
All right. All right. Do what to listen over the radio.
I can finish 2 wraps of apple.
All right.
I can eat very, very well, but if the food is available, I can eat. But I don't know. I'm just losing weight. I don't know whether because of my BP and drugs I'm taking. I don't know.
All right.
Okay. Besides high blood pressure, do you know of anything else you have? Any other medical problems?
I have BP and I have ulcer.
Okay. All right.
Do well to listen over the radio, Emmanuel.
Please, so that you tell me what I will eat so that I can gain my weight back.
Yes, just listen over the radio. All right, doctor.
Yeah, so Emmanuel, is concerned. He said since May till now, we're in this September, right? So
yes.
4 months, he's lost 3 kg, right?
Or 5. Lost more, 5.
Almost 5 kg. Okay, so over 1 kg per month is significant. It could be significant. We start getting worried when you have a 10 kg loss of weight. You really start worrying.
Okay.
But the fact that he's complaining and noticing it, you always want to think about chronic disease. Okay, so it's not as simple as, hey, Emmanuel, just go and get this off the shelf and start taking it. You really want to make sure that he's not suffering from some chronic disease. For example, chronic liver disease, chronic kidney disease, and diabetes, and of course cancers. Cancers are the number one. So that's why I'm asking about age. 50-year-old man, what
62.
cancer? Oh, 62-year-old man. He's at risk for prostate cancer. He's at risk for colon cancer, and he's at risk for diabetes. He's also at risk for chronic kidney disease because he's mentioned that he has high blood pressure. High blood pressure can also affect the kidneys. All 4 of those chronic diseases can cause you to have weight loss. You're eating the same, but weight is you're losing weight. So he needs a checkup first before just just eating around or taking supplements or just random drugs. Then from there we can now advise him properly.
What to do.
Yes.
All right. Thank you very much. Hello, good morning.
Yeah, hello, good morning.
Good morning. What's your name and where are you calling from?
Yes, my name is Precious. I'm calling from Mikurugi.
Precious.
Yes.
All right.
Good morning.
Yes, good morning.
Yes, I have a question for the doctor.
Yes, go ahead.
Doctor, good morning, sir.
Good morning, Precious.
Yes, my question is this. 4 years ago, I had my last child. And when I had him, he did not stop because my breast did not even lactate. So,
you said it did not stop.
No, he didn't suck.
Oh, he didn't suck. Okay. You didn't get any.
She wasn't lactating.
Okay.
Hello. All right. Do want to call back 07000 917 917 or 90256 25455. Send a WhatsApp or a text message to 070 317 56537. So still talking about dieting, what are the appropriate meals for dieting?
Yes, so the advice I would give a 60-year-old is different than the advice I would give a 20-year-old. But the general type of advice and we're talking about dieting can either be to increase or to decrease weight. Just to
so let's take this call. Hello, good morning.
Yes, good morning. Precious calling back.
Yes, Precious.
What I was saying is, I had my last child 4 years ago.
Okay.
He did not stop. Because the breast didn't even lactate at all. So, but now I've been trying to get pregnant and I'm finding it difficult. So, could that have affected me getting pregnant?
All right. Do you have any questions?
Okay, and you said that was 4 years ago.
Yes.
Yes.
Okay, how old are you now?
I'm 37.
37? All right.
All right. Do want to listen over the radio, Precious?
Thank you.
Yeah.
Yes. Little known fact here. On this side of the ocean, is that from 35, it starts getting harder for women to get pregnant. And different things can change. Some of them can be hormonal.
Okay.
Which sounds like that's more than likely her issue because there's a hormone prolactin that's involved in milk letdown or milk production, as well as if your prolactin levels are off, whether they're too high or too low, you may not ovulate.
Okay.
And that will also, ovulate means releasing of the eggs from the ovary, and that will also make it difficult to get pregnant. So somebody like
Precious.
like Precious, she would need to start with, a hormone profile, and those are done on certain days of her menstrual cycle. One of them fasting, while she's fasting, and then we now take it from there.
All right. Thank you very much. Hello, good morning.
Hello, good morning.
Good morning. What's your name and where are you calling from?
I'm calling from Ikorodu.
Yes, your name.
I'm Irene.
Irene. All right. It's good to have you this morning.
Thank you. Good morning, doctor.
Good morning, Irene. Not heard that name in a
long time.
Please, I have two inquiries to make from the doctor.
Yes, go ahead.
All right. Firstly, a baby of she's under 2 months.
Okay.
That the first week of her delivery, we noticed that, this frequent shocking as if she's sleeping. It could be on and on for good minutes. What could be responsible for that?
Since it makes...
She's
said,
shocking.
Oh, okay.
She's shocking.
Okay, like a shaking? Okay.
Yeah, she really shocks. Mostly when she's in a deep sleep.
Okay.
You see her shaking, really shaking, all her body, all over.
Okay.
What could be responsible, doctor?
All right, and how old is she now?
Less than 2 months.
Less than 2 months?
A month plus.
A month plus. And she's been doing it since. Does she have a fever?
No, she
No?
never had a fever. In fact, and when it hits up, it's like it's hitting into my room too.
Okay. Is it worse when you urinate?
No.
Okay. What makes?
When I urinate, I don't feel anything.
Okay. So when do you feel the pain?
It puts down. Yes.
When do you feel the pain?
Sorry?
When do you feel the pain?
No fixed time. Mostly when I'm lying down, I just feel, but no fixed time. I could be sitting and I feel it.
Okay.
All right.
Yeah.
All right.
Do you want to listen over the radio?
Yes, I want to listen, but there's something I want to add in. I'm just thinking. I didn't know because I'm 54.
Okay.
I didn't know because I was telling a pharmacist, a friend. She said it could be one of these menopause things. I didn't know how menopause could be giving me that kind of sensation.
All right. Just do well to listen over the radio.
Thank you.
Yes.
All right. So really she has about let's say 2.5 questions. So the first question is a less than a 2-month-old baby that she described as a shocking or a shaking. Something worried me in that story was that she went back to a doctor and they just started her on started the baby on 2 drugs. It sounds like the baby's having a neurological or a brain disorder. Okay. It could be misfiring of some nerves. It's like seizure disorder. Okay. Or it could be that baby was deprived of oxygen sometime during the labor, and it's I'm going to call birth asphyxia, meaning lack of oxygen. All of those can give brain or nerve damage. All right, and can sometimes lead to seizures or convulsions. Okay. That's shaking. But you don't just diagnose with medication, especially in a child that young. The child needs to be evaluated by a neurologist. Okay. Neurologist is a doctor that specializes in the brain but doesn't perform surgery.
Okay.
So it needs to be evaluated. There's some tests called EEG, EMG that need to be done, and it will look at the brain waves and see if the person has what they call a elevated or a lowered seizure threshold. Okay, so if you have some of these things on the test results, then we'll now talk about managing with medication. But these drugs have a lot, especially anti-seizure medications, have a lot of side effects. So it's not something I would just take lightly, and especially wouldn't take it without running some diagnostic tests. Okay, so if they get in contact, because there's not many neurologists in Nigeria, qualified neurologists, so if they get in contact, we can arrange for them to get the baby. The other one The other one she described was a burning sensation at any time. And she mentioned that she's 54. You know, menopause can be anywhere from 45 to 55. That's on average. And can be associated with hot flashes, tingling and sensations and anywhere, sometimes in the extremities, the hands and feet, as well as mood. Some people have mood swings and things like that. So it could be part of perimenopausal or menopausal syndromes, especially if she's noticing that her menstrual cycle is starting to become irregular, you know, and get longer. Blood tests can actually tell us whether she's perimenopausal, meaning close to menopause, or menopausal. And you know, these tests don't take long for the results to come out, you know, within 30 minutes. And then also we need to take a look and at her vagina and see if there's anything there, an abrasion or a cut that may be also giving her pain.
All right. Hello, good morning.
Good morning.
Yes, good morning. What's your name and where are you calling from?
My name is Mr. David. I'm calling from Suez.
Yes, David, it's good to have you. Yes. What question do you have for the doctor?
Doctor, there is something I want you to clarify. I'm an hepatitis B patient. Hello?
Yeah, so
we're listening.
Yes. Then that was July. Then I came back to travel. Then I was having I went to the hospital. They did my blood test. Then the doctor told me that the liver is high. That I should take a scan.
That the what is high?
My liver function test.
Okay.
Yes. Then and I should go and see an hepatologist.
Okay.
Then I took it to, because I'm under an HMO. I took it to the complaint doctor. Then he went to told me that I should go and do a scan. I did the scan. They got the scan. The result, they said that the liver is fine. The pancreas and other things, they're fine inside. But I have pain. I have been having that pain at my right side of my tummy. It's completely. Meanwhile, before then, I have been giving this Caffeine to be taken. Then I later went again to meet a specialist, a physician. Then he gives me good deal of tests again, all the good tests and scans.
Have you done viral load?
Yes. It is a viral load.
Okay. What was your viral load?
For my company, it was 3,000.
3,000. Okay.
Yes.
All right.
Then with other things, he said, which I cannot explain it, because other things he wrote in the result. Then he told me that the average is, in fact, for that with that result, and the virus there is 4 months. That was what he's trying to tell me. With the result, with that result there, there's other things he was setting result there. I don't know what you mean by that. And the virus there is 4 months, no other active like that.
All right.
Then I said, okay. Then, but now I've been having serious pains in my right tummy. Well, whenever I sit down, the pain is too much there. Then I want to know what is the next thing now to do now.
All right.
Do you want to listen over the radio?
Okay.
Yeah.
So this is a patient that's talking about hepatitis B. Okay, hepatitis B is quite complicated, so I'll make it very simple. Okay. And the other thing about hepatitis B is that the treatment guidelines were recently changed, and they're constantly being updated. But they recently underwent some changes. So the screening test that all of us do, usually we do it for employment or you're working in the food. It's called hepatitis B surface antigen. It's a rapid test. You can get your result within 30 minutes to an hour. And if that is positive, it just means that you've been exposed to hepatitis B at some point in your life, and you now need to go further and do further testing. So hepatitis B is not really something that you diagnose with a ultrasound or a scan, like you said. It's a what we call immunology. There is a blood test that you need to do. So if you have something called an envelope antigen, if that's positive, right, and your hepatitis B surface antigen are also positive, then we now do something called viral load. That you heard me asking them about that. Viral load is just basically how many copies of the virus do you have per drop of blood. All right,
Okay.
and you also use that in your treatment guidelines. So the latest ones are now, if it's above 2,000, viral load above 2,000, you go ahead and treat. Okay, and hepatitis B treatment is 6 months and longer. Okay, so it's not something you just take a drug here and there. It's 6 months and longer. Some people treat for a year, 1 year to 18 months. And also, if your liver is showing signs, because sometimes your liver function test will be normal and you'll have hepatitis B surface antigen positive. But if your liver function tests are abnormal, 1.5 to 2 times the normal, then you also treat. Okay, so this is somebody that I would look at all his test results and see, has he been, we can't discuss medications on the air. So has he undergone proper treatment, because he does fall in the category of people that need to be treated. The advice I give to the other listeners and him as well is that once you're positive, your family members should also get tested. And if they're negative for the surface antigen, they can actually do a hepatitis B vaccine. It's 3 injections over the course of 6 months, and it's worth the investment.
Okay, all right. Thank you very much. And it's already, 26 minutes to 11 on WFM 91.7, and it's Radio Doctor. And I still have Dr. Abiola Ajayi in the studio. He is the MD CEO, ROA Specialist Hospital. If you want to reach him personally, call 0705 919 2017. 0705 919 2017. And he has been discussing about dieting, fasting, and eating what's the best way to lose weight, and he's been doing justice to that already. Hello, good morning.
Hello, good morning.
Good morning. What's your name and where are you calling from?
It's Chooks from Aja.
Yes, Chooks, it's good to have you this morning.
Yeah. I already told you about my situation the last time. Concerning, I had a broken limb. Member of my tibia and fibula. And,
he called in before.
I was on POP for the past 5 months, but the POP has been removed now, and I can use the leg to walk. But when I'm walking now, I have pains on the neuro side. So they have recommended me for physio.
For what?
Physiotherapy.
Oh, okay.
Yeah, so I just want the doctor to. The physio is a little bit expensive, I must confess. The financial aspect is a little bit, tedious for me. And secondly, on the aspect of the diet, I found out that I can't eat the way I used to eat. I'm over 50, and I'm losing appetite. Sometimes what I want to, if I feel like eating what I want to eat, I need to go out for it. But not like it used to be. So those are just advise me on the pains. I'm feeling the pains when I'm using the leg. I was working with it before, but I've thrown away the it. I'm working by myself. They give me.
All right, we'll talk to you. I'll give you some advice now.
All right. Do you want to listen over the radio?
I remember talking to him before. I tell you the truth. These types of questions used to actually irritate me before. I'm saying before. But now that I've been here long enough and I understand what the average citizen is going through, I feel, I feel more compassionate. I feel sympathy for a lot of people, because it's not easy to try and, I got stuck on this our road here for 5 hours the other day. And that was even on a Sunday. And then I'll mention later about the nonprofit I'm working with, and I have to go to the island sometimes to spend 5-6 hours on the road. So I my heart goes out to people that have to do that on a day in and day out, and then you try and do it on small amounts of money. Inflation is going up. So my only advice, since he called in last time and since he's called in now, I've still not seen him. So I don't know whether this bone is healed. I don't know. I've not even seen an X-ray, so I can only give very general advice. I can't really advise him directly because I've not evaluated the patient. It would be irresponsible of me. If you were told to do physio, I mentioned before that the physio will actually help the bone. If it's not finished healing, it help the bone heal. It stimulates bone growth or stimulates osteoblasts. Other things that stimulate osteoblasts are diets high in calcium and vitamin D. So you can try, and you can go to your internet search and look up foods that contain calcium or vitamin D, or try and contact me after the show, and I can give him some of those. Those can also help bone production. With the physio, and I understand it's expensive, but try and invest, because if you don't take care of a bone on time, it may heal improperly and you'll have pain for forever. So the best thing to do is try and invest in a few physio sessions, and then repeat the exercises even when the physiotherapist is not there. Okay. So, if you can afford 1 or 2 sessions, fine. See the exercises that he's doing. Nobody says you can't do them when the physio, he or she, is not around. It's not bad form. They actually encourage it. Okay. So the more you do on your own, the faster you will heal. Okay. And other than that, I would encourage him just to come and get a consultation, and we try and put him on the right path.
Okay. And a text message here says, "Good morning, sir. My name is Adiola Agoro, and is Lipton good for somebody with high blood pressure? I'm using it to lose weight, but can it worsen my high blood pressure?" And the person is 42 years old.
Yeah, anybody taking, I won't say the name brand, but whether you're taking black tea or green tea or most of these teas, unless it actually says is decaffeinated, all of them contain caffeine. Even green tea contains caffeine. So caffeine raises your blood pressure. All right. Okay. So in terms of, is it good for somebody that has high blood pressure? No, it's not. The reason why it's helping her lose weight, or why she's taking it for dieting, is because caffeine also curbs your appetite, or cuts your appetite. So, but ideally, you try and tell people that have high blood pressure to avoid caffeine. This is somebody, and that's good for this topic of intermittent fasting. With that, the thing about the intermittent fasting is that the times when you're eating is you try and eat healthy, right? You eat that high in fiber and high in protein, but it's not really about what you eat as much as when you eat it. So you can eat the things you enjoy within reason, and then for the 8 hours in the day, and then for the other 16 hours, then you're really strict on your fasting. All right. The other thing is your carbohydrates. The type of carbohydrates you eat are actually very important. No added sugars, and you want to reduce processed carbohydrates. So you want the grains, the rice, and things that still have the shell or the husk on them. I think ofada rice is that type of rice. So you want to take those types of grains too, more than the stripped down white ones.
All right, thank you. Hello, good morning.
Hello, good morning.
Yes, good morning. What's your name and where are you calling from?
Yes, this is Ade calling from Arepo.
Yes, Ade.
Yeah. Yes.
You rarely get calls from Arepo.
Yeah.
Hello, I want to ask, there's one symbol I saw. This is a medical symbol. There's one snake around that ran the cross. I want to ask, what's the meaning of that snake?
Is that all you have for the doctor?
Yeah, that's what I just want to ask.
All right.
He's taking me back to before medical school. All right. I know to be honest, I know it's origins in Greece, I believe. The father of medicine, his name I think it was Herodotus or so, and there's Hippocratic, Hippocrates. Sorry, okay. So there's a Hippocratic oath that all of us take when we become doctors, about doing no harm and things like that. So I know it's rooted back in I think Greek times. But the actual significance about it, if any doctor is listening, maybe they can call in and give us some of the history. But I can't really remember.
Right.
And I know I just embarrassed some of my colleagues. So.
All right, thank you very much for that. Hello, good morning. Hello.
Hello, Hello, good morning. My name is Lekon.
Yes, Lekon, you're calling us from where?
Calling from Lagos, my school.
Okay, your question for the doctor.
Yeah, good morning, doctor.
Good morning.
Yeah, I'm just curious. My daughter, she's 2 years plus now. So she speaks well, she speaks, but her voice is not that clear. So I want to know if it's normal or there's something I should do about it.
She said, how old is she?
2 years plus.
2 years, and you think the voice is not clear?
Yeah, it's not very clear. She speaks very well, but the voice is not clear.
Okay. All right.
I want to know.
All right, do want to listen over the radio. Now the voice is not clear.
Yeah, I mean, you know,
Still
it's very is difficult to answer that question because I don't know what not clear means. You know, and I'm always careful about diagnosing children because you give them a label and it sticks for life, and you may be mislabeled. So 2 years old, just depending on how bad it is. If it's bad, you want to see a pediatrician and or a speech pathologist, and they actually have them in Nigeria. I've referred a few patients to them, and they can work on pronunciation with the child. But I know most of them, if it's not so bad, would probably wait a little bit longer than from 2, because children are still learning to form words at age 2. But if you're still having issues at age 4, 3 and 4, then I'm not saying he should wait. I'm just saying if you're worried, the person to see is either a speech pathologist or a pediatrician.
All right.
Okay, but still temper your expectations in a 2-year-old.
Okay, 16 minutes to 11 on WFM 91.7. And this is Radio Doctor, and we have Dr. Abiola Ajayi in the studio. He is the MD CEO, ROA Specialist Hospital. If you want to reach him personally, 0705 919 2017, 0705 919 2017, and reach him in the studio 07000 917 917 090 256 25455. And this text message.
Can I redeem myself quickly?
Okay.
The joy of modern technology. So it is, caduceus is the snake symbol. And it is in ancient Greek, and it symbolizes rebirth and fertility.
Okay.
So I got that in before anybody called and embarrassed me.
All right, that's very good.
All
and
right.
yes, I have this one. This is from Loveline, and she said, "Please, sir, my menstruation is not regular. Sometimes it can stay for 2 to 3 months. I won't see my period. Okay, I can stay for 2 to 3 months and I won't see my period. I had a toilet infection, but I treated it and it's gone. I last saw my menses 5th of August. Till now, I have not seen it for this month, and I am not pregnant. Please, what could be the cause?"
Yeah, this is somebody that maybe can contact us through, because I know we're maybe give us more information or contact through some of our social media platforms, because age, sexual activity, number of times she's been pregnant, all of those are going to make a difference. And then also types of activities, whether she's under emotional or physical stress. I need to know about all of those. But what she's describing is amenorrhea. That's absence of your menses, and it can be caused by it could be caused by infection, like she mentioned, but it could also be caused by just if it's a very young person, their period is not really set in, become regular. That can also be an issue. And then those that are under severe emotional or physical stress can also have amenorrhea.
Okay, all right. And yes, going back to the topic of the day, you were talking about the kind of meals that are appropriate for dieting.
Yeah, so when you're talking about the meals, of course, when you start reducing your calories, you want to make sure that you have enough proteins, and you want lean proteins. But like I said before, when you're talking about intermittent fasting, is more of when you eat than what you eat.
Okay.
And so you're looking at your diet high. What I usually tell people is take a small plate, divide it into a third, and 1/3 would be your protein. Your protein could be like your chicken or your or turkey, or one of the one of the
What are
less
beans?
fatty. Beans are also very proteinous, as my grandmother used to say, and eggs also have protein. What's that?
Moi moi.
Yes. All of those are high in protein. So 1/3 of your plate would have proteins. 1/3 would have your carbohydrates, either your rice, your swallows, or your pastas.
Okay.
And the other third would have your vegetables. Okay. Then when you alternate meals, you can substitute a vegetable for fruit.
Okay.
As you see fit. It's more reason why I keep stressing I'm not giving so many specific meals is that you want it to be something that you can actually keep varying and stay engaged.
You don't get tired.
Exactly. So the longer you stay engaged, because remember we're trying to shift your body's metabolism. We're trying to tailor your body to stop storing fats and start burning fats, and that conversation is not an overnight conversation. So meaning the longer you stay consistent with the diet, the more serious your body will be about increasing metabolism and burning fats.
Okay. All right. Hello, good morning. Hello.
Hello?
Yes, good morning. Good morning. What's your name and where are you calling from?
My name is Michael and I'm calling from Lekki.
All right, Michael, your question for the doctor.
Okay, please, I have a urinary tract infection. And this thing has made me to, whenever I'm urinating, I will find it difficult. But I went to diagnose the hospital, they diagnosed me. They said the urinary tract has a stone. That is something that is preventing my urine to flow. So I want to ask doctor, apart from surgery, is there any other thing that I can do?
Is it a bladder stone or a kidney stone?
No, it's a bladder stone.
Okay. And how old are you?
I'm 52.
62?
50.
52. Okay. And how many times do you wake up in the night to urinate?
At times I can wake up like
Hello?
to urinate. At times I can wake up 3 times.
Oh, okay.
Sorry, can you repeat the number of times that you urinate at night?
At times I can urinate more than 7 times. At times I can urinate more than 3 times.
Okay.
Okay.
All right.
Do also listen over the radio.
And do you have a size of the stone? Do you know the size?
No, but I have the result with me. So
Okay.
I don't know if there is a.
All right. I'll give him an answer.
All right. Do also listen over the radio. Yes.
I most mentioned I do this show to help as many people as possible. So that's somebody that can contact us through, because I can look at the result and the size. But the general kind of advice, having a bladder stone, bacteria actually colonize or live on the stone, and or the stones in the bladder. So you'll constantly be having the urinary tract infections. That's one. Two, sometimes if the stones are mobile, they can actually block the emptying of urine from the bladder. All of those leading to bladder outlet obstruction. So all of those things can cause the frequency or the nocturia, meaning urinating frequently or waking up at night to urinate. Depending on the size and the location of the stone, you may be able to do, he said other than surgery. When you think about surgery, you think about taking a knife and lacerating somebody's belly, and right. But the types of surgeries, a lot of times we do stone surgeries without making any incision, especially in men and women. We put a camera in. I'm doing one this afternoon after I leave here. Put a camera in. We can actually, if the stone is not too big, I can actually crush the stone on the camera and bring out the chips. Okay. Or sometimes use a laser to break up the stone. If it's massive, it just depends on the size and the placement. But bladder stones, you can typically sometimes just crush them and then you bring the bladder out, or use a laser to break them up and bring the bladder up. So by the time you finish, the patient just has a catheter, a tube in their penis for like a day, and then it just depends on how much how the surgery went, but anywhere from a day to 3 days. And then, but the main thing is that no incisions, and they usually go home the next day. you know. So but the thing about it is that if it's large, it's very difficult to dissolve those stones. They'll continue getting bigger. So the sooner you take care of it, the better for you.
Okay,
definitely.
So is exercise really, really effective in losing weight?
Yes, it is. There's for dieting, when you talk about exercises, it follows the 70-30 rule, meaning your change in weight is going to be 70% diet, 30% your exercise plan.
Okay.
So and we mentioned before, dieting is the modification of our intake to increase or decrease our weight. So if I want to increase my weight, 70% of it is diet, eating more calories than I burn. But if I want to increase muscle mass in my chest, then I need to do exercises that are going to stress the muscles of my chest, and that's 30% of the battle. Same thing for weight loss. You know, diet can take care of 70%, and 30% of it is exercise. So some people can achieve their weight goals, rate reduction or weight gain goals, without doing any exercise, because and some people, if the goal is so much, then you'll definitely need to have exercise. So
before we wrap up, does exercise actually make one keep in shape?
Yes, but the thing is, exercise is good in all people, but you need to make sure, number one, that you're stable enough to actually undergo exercise. Okay. And exercise is different for different people. There's some people, I say 3 times a week, walk so that your heart rate increases for at least 20 minutes each time. All right. So, but there's, those are some older people that have high blood pressure or diabetes and weak bones. But you have a younger person that doesn't have any other sicknesses, then you can prescribe a more strenuous exercise program. All right.
Thank you very much for coming in, Doctor. What will be your final words today?
Today, a lot more than other weeks, a lot of people have, questions that I can only give general answers to. So, and in the studio today, we have our marketer, Tosin, is with us. And, we are on all the social media platforms as ROA Specialist Hospital. And also have a YouTube channel as for ROA Specialist Hospital, and I try and answer all the questions I can as often as I can. So people can reach out and we can continue the conversation.
All right. Thank you very much for coming in today.
Thank you.
Yes, and that was Dr. Abiola Ajayi. He is the MD CEO, ROA Specialist Hospital. If you have to reach him personally, 0705 919 2017. 0705 919 2017. He will definitely get to answer whatever questions you may have as regards your health. And Radio Doctor is Nigeria's first specialized radio health program where real doctors advise real people. Each day is dedicated to a medical specialty with an expert to offer consultation and advice. And yes, it's broadcast 10 a.m. to 11 a.m. Mondays to Saturdays. We'll be here again tomorrow. Tomorrow we'll be discussing about teenage health, and you really don't want to